Hey guys, welcome. Just doing our videos last week. I'm going to do self-care either later today or over the weekend, but I have, in case you have to get a C-section during pregnancy.
In today's video, we'll discuss what you can expect during your C-section. Hey guys, welcome back. My name is Dr. Bob. I am a board-certified anesthesiologist, and listen, you already know, on this channel, we talk about all things education, motivation, and personal finance delivered to you in an easily understandable and relatable fashion. If you like what you see and you find value in our content, please feel free to like, share, and subscribe to the channel. Just for the past 7 years, and I've been to contact first-time moms who are otherwise terrified with the possibility of potentially having a C-section or just the act of having a baby. In today's video, we are going to get into all things that you can expect during your C-section. Now, for the purposes of this video, we're going to sort of stick with the script that you are an otherwise healthy female who has an unremarkable pregnancy and are scheduled to have a C-section. I'll cover emergencies in a different video. Now, before we get down to the nitty-gritty, I'll say that, I don't represent every anesthesiologist, nor am I practicing in every state in the United States. But what I will say is that, for the most part, us anesthesiologists are pretty much alike, and we do most things pretty much the same. So if you find yourself in a United States-based hospital, things will primarily go this way. Now, before we start talking about exactly what to expect, we should probably first define exactly what a C-section is. Now, C-section stands for cesarean section. A cesarean section is essentially a surgical procedure used to remove a baby from the abdomen as opposed to the vaginal canal. Now, there are many reasons why obstetricians may decide to deliver a baby this way, but for the purposes of this video, we won't go in depth about the indications and contraindications of actually having a C-section. Let's just sort of stick with the script that your obstetrician has already told you that you have to schedule a C-section. Now, once you've reached full-term gestation, your obstetrician will decide exactly a particular date for you to be scheduled to have your cesarean. It's super important for you to adhere to all the fasting recommendations that are given to you preoperatively. Under normal circumstances, you'll be instructed not to eat anything after midnight. Once you show up to the labor and delivery unit, you'll be admitted, and the anesthesiologist taking care of you will be notified. Now, typically, before calling the anesthesiologist, the nurses taking care of you will have done a few things. Under normal circumstances, they will have placed an IV line and started hydration. This hydration is of extreme importance for you because these procedures can result in a lower blood pressure. Therefore, we try to give you enough fluid so that we can offset the potential lowering of your blood pressure as a result of the procedure. So once you have an IV line, once you've received some hydration, at this point your anesthesiologist will probably come to find you. Once your anesthesiologist arrives, they'll probably start doing what we call basically in layman's terms, a history and physical examination is information regarding your pregnancy, your past medical history, your medications, allergies, etc., in order to get an idea as to how sick you are or what type of risks are involved for you, particularly in doing your procedure. Make certain that you adhere to the fasting recommendations because the anesthesiologist will ask you when the last time you ate. You need to have not eaten in at least 8 hours. After getting an appropriate history and physical examination, the anesthesiologist taking
How are you?
Begin what we call
Good.
They will typically go over exactly what you can.
I was doing a
hit the door and get into the room for the C-section.
overview of cesarean section. You know anybody who has C-sections?
They'll give you written permission to proceed.
Really?
Now that you signed everything and given your permission, it's time to get down to the nitty-gritty. The nurse will typically walk you to the operating room and have you sit up onto the operating room table as if you were sitting on a park bench. Now, depending
It seems
on the
frightening.
anesthesiologist staff and the policies at your hospital, you either have what we call a spinal anesthetic or a combined spinal epidural anesthetic. In layman's terms, you're going to be numb up to your breasts. Sometimes we leave an epidural catheter in the epidural portion of this in order to help with pain after the procedure.
They give you fentanyl,
You're probably going to be pretty nervous.
so you don't feel anything.
And we're going to jump the ditch together. The first thing your anesthesiologist is going to do is probably put on some oxygen and then attach the monitors that are used to keep you safe. Typically, in this case, we will normally attach the blood pressure cuff and the pulse oximeter. You feel your anesthesiologist touch your back, clean your back off, and settle the sterile field with the drip. Next.
So my wife got the drip, and they basically like go directly into your spine. And it's like fentanyl, which people use instead of heroin. That's what like a lot of the overdoses are from. And it's so you don't feel the pain. So a lot of people do it nowadays. A lot of people are like, no, I'm going natural. I don't want my kid to experience the drugs. The drugs aren't supposed to go to your kid, but sometimes I feel like they do or they can.
Comes the big pinch. Essentially what that means is we give what we call lidocaine or numbing medicine to numb the skin.
How far is it? Oh, this one's a little longer than I
So
thought.
that you actually don't feel the spine. Typically you feel that discomfort with the numbing medicine for about 5 seconds. Once your skin is numb, we then proceed to start the spinal anesthetic. Normally, most patients represent this as kind of like a pressure sensation. Before I go any further, I should probably give a brief explanation as to exactly what a spinal is and how it differs from an epidural. Spinal anesthetic is essentially pricking the small dural sac where the cerebral spinal fluid is bathing the spinal nerves. We inject a small amount of local anesthesia there, and it causes immediate numbness. That numbness then travels up to your chest, and then you remain happy during the C-section. That differs from an epidural, which is a catheter that sits outside of the dural sac. Small difference, same result. You'll be numb. So once the anesthesiologist injects the spinal dose of local anesthesia, you will notice immediately some sensation changes. Your butt will warm, and progressively you won't be able to feel or move them. That numbness will then travel up to your breasts, and you will be numb from your breasts down. After the spinal dose of medication is in, you're laid down in what we call the left uterine displacement position. This is used in order to decrease the likelihood that your baby will sit right on top of you and not get enough blood flow. In layman's terms, you're just tilted to the side. So now the hard part for you is done. You won't feel anything after this. So as you're laying down, a bunch of things will happen. This will seem sort of like a pit crew. The anesthesiologist who's taking care of you will probably start to check in with you and ask you how you feel. You may also notice the anesthesiologist taking care of you looking at the screen a lot. The reasoning for this is because after spinal anesthetic, you can have a lower blood pressure. This lower blood pressure can be manifested as nausea. Now, you can get nausea from this experience despite having normal blood pressure, but we like to make sure that your blood pressure is normal, not just because of the nausea, but also because your baby doesn't like lower blood pressure. So more than likely, you'll see your anesthesiologist also giving you oxygen, also increasing the fluids, and possibly giving you medications to maintain your blood pressure during this time. Now, meanwhile, you have the anesthesiologist doing all this stuff. You got room nurses who are also sterilizing your belly and prepping you to have the operation. Now, at this point, it's important for me to explain a couple of things, especially in regards to the way you're going to feel at this time. With a spinal anesthetic, you will feel people touch your body, but you will not feel any pain associated with the things that otherwise cause pain, like cutting your abdomen open. In addition to the touch you may feel, you might also feel tremendous pressure at times. Namely, you'll feel lots of pressure when the obstetrician is moving the baby. Additionally, during the repair of the uterine incision, you may feel things like chest pain. You're not having a heart attack more than likely. It's just referred pain because of what they're doing. Again, it's also pretty common for you to become nauseous during this experience as well. So if you experience any of these things, understand that they're unfortunately part of the course. So at this point, the spinal anesthetic has had plenty of time to set, your belly has been appropriately sterilized, and you're in a good way. Now it's time for the surgery to get started. The first thing that happens is your obstetrician and the assistants put up a blue drape. Once the blue drape's up, there's no turning back. You're gonna have this baby. Now, prior to actually starting this operation, I'm sure you're completely teeming with anxiety and worried that you're going to feel something that you aren't supposed to feel. Don't worry. Before we start anything, the obstetrician ensures that you don't feel anything. Once we perform a test to ensure that you don't feel anything, whomever you decide to come in the operating room with you, whether that be your husband, your boyfriend, or your significant other, can come right on in. Now, this is the important part. Tell the person who's with you to distract you. And also tell them to bring their cell phone because you want to capture the memories, right? Now, under normal circumstances, when you start a cesarean, it doesn't take a very long time to get to the baby, assuming you haven't had abdominal surgeries before and you haven't had a C-section before. You'll know you're getting close to the time of delivery when you hear these words: uterine incision. This means that the obstetrician is going to incise the uterus and deliver the baby. This is when you'll feel the most pressure. So as the baby's being delivered, you may feel as though an elephant sitting on top of your chest. This is because of the maneuvers that are necessary for the obstetrician to remove the baby from your uterus. And just like that, life happens. Your life's changed. The baby's here. Sometimes the babies cry, sometimes they don't. But either way, the baby will be handed off to a group of pediatricians and nurses that will be there specifically to ensure that the baby is safe. Under normal circumstances, this is done with an eye shot of mom. Under normal circumstances, if the baby's doing okay after the initial assessments, they will wrap the baby up and bring the baby over to you so you can inspect your new bundle of joy. But we're not done yet. Your uterus and your skin still needs to be closed. So while all of these other things are happening, your obstetrician and their assistants are taking care of that. In addition, your anesthesiologist is doing a bunch of things as well. Once your baby is delivered, you have to receive a medication called oxytocin. Oxytocin is what we call a uterotonic. In layman's terms, it's a medication used to make your uterus go back to normal. The reason why this is because a floppy uterus is dangerous. A floppy uterus can bleed. No one wants to bleed. You don't want the bleeding. We don't want the bleeding.
Yeah, when they told my wife that, she was kind of freaked out. She's like,
or you're having discomfort, the anesthesiologist will also administer pain medication and or anti-nausea medication. Now, under normal circumstances, it can take a little bit longer to make.
Like the nurses, after you have the baby, they massage your uterus, so they kind of like push to make sure you don't get blood and bleeding and whatever. So that along, having a new baby and all that are a lot of the stressors after having a baby. So as a social worker, making sure that we're like giving them support. I think we only had one social worker check in with us, but just making sure they don't have what they call postpartum depression. So that's one of the things that comes up.
Make the repair of the uterus and the skin relative to the amount of time it takes to actually get to the baby. So don't be alarmed if it takes a little bit longer to close things up than it did to actually deliver the baby. But the good news is that at this point, you're going to be distracted by your new bundle of joy. Now, assuming everything goes well with your repair, you made it. After the obstetrician and their assistants are done with your uterus and your skin repair, you are then disconnected from all the monitors and shifted onto a bed for recovery. The final thing typically done by most obstetricians is something called the fungal height check. Again, we talked about the fact that you get medications to make your uterus clamp down in order to decrease the risk of bleeding. Your obstetrician wants to ensure that your uterus is moving downward in your pelvic area in the appropriate fashion. So they palpate your uterus through your abdomen. Initially, you won't feel this. But unfortunately, the nurses taking care of you in recovery will have to continue to do these fungal height checks in the recovery.
Really? What is it?
My thing is stuck, so I can't turn the sound off.
Oh.
I can't put on my phone.
Is it like the case is blocking it or something?
No, I kind of drop my phone a lot of times.
Okay.
Just,
Yeah. It can happen. It's like I wanted to, so just kind of like finishing up with the part and what we had last class. This class, I wanted to kind of just get us refocused. I know it says what I'm talking about, which is weird. I don't know how to turn that off either. So basically self-care. I forget what years you guys are. Are you like sophomores, juniors, or seniors?
I'm a junior.
Sophomore, okay. Has anybody done a self-care presentation for you? As I was going to say, are you tired of a self-care presentation? It's okay if you are, but we want to always remind you guys, like, are you both social work majors? Okay. In social work, it's extremely important to do self-care because there's so much that we're doing. And so much going on inside and outside of our jobs that maybe you guys already do something for self-care. I don't know. Do you have anything you ever do? Yeah. Yep. That's good. Yep. That's important. I know that sounds crazy, but it's important. I would tell my wife it's crazy because it costs so damn much money, but I'm like, you got to do that so you can you got to take care of yourself before you take care of others. So that's kind of what this is about. And I do this in every class. If you've had me before, you've heard this, but I just push self-care because it has a nice little quote to introduce us, but it's like in the theater of life, the other becomes illuminated part of the stage. I is outside of the illumination. So like we're always serving others, taking care of others. If you have kids or nieces or nephews, maybe you're always taking care of them. And if you forget to take care of you, you can burn out. So it says their hopes, their goals, their dreams, pains, fears, and despair and anger are in focus. Like a leaf under a microscope, we see all of this highly illuminated detail. And as a counseling therapist, it should say, teaching or health practitioner, the other gets our attention. And we easily lose sight of our own needs, like the needs to not respond to all needs. So basically, here is just saying that you can experience burnout with these stressors from secondary traumatic or compassion fatigue, and you can do self-care to prevent this. And I just want to kind of zero in on that and focus to make sure you guys are, I have to be reminded of it. So it's not like preaching. I'm preaching to the choir, but like I'm speaking to myself. Like I need to be reminded every semester about that self-care because it's 15 weeks long. It's not a sprint, it's a marathon. So you could get, as social workers, we can experience secondary traumatic stress and or compassion fatigue. So what that is, it's a set of symptoms that occurs in individuals experiencing trauma. The symptoms mirror post-traumatic stress disorder in people that had gotten the direct trauma. And the symptoms could be flashbacks, nightmares, arousal, anxiety, hyperactivity, and avoidance and dissociation or numbing. Here's other things you might experience. And for us this week, like self-care might be like getting out of the heat and like drinking enough water. I know that seems like simple, but it's easy to forget too. Is it still 90 out there?
Mm-hmm.
Right. It just is so humid, and they said that they fixed our stuff, but it's definitely interesting. And that's a part of the social work job. I see clients on the side, and I had JFS call me. It's like Jobs and Family Services and Child Protective Services. So I got to call her back now. But I'm going to make sure to eat my lunch or dinner. I don't even know what time it is now, and drink enough water first. So if you don't do self-care, you'll have a lot of this. So like avoidance of reminders of the trauma, persistent arousal, like it makes it hard to sleep, intrusive thoughts or images of clients or your own traumatic experiences. Like if you do therapy as a social worker, you'll hear messed up stuff, and like it could be loss of a loved one, domestic violence, things like that. And it stresses you out as the social worker as you want to get them help. So you got to make sure to do self-care in between clients. Difficulty separating work from personal life, making sure to like turn that phone off 9 to 5. And then vice versa, not letting our personal life dip into our work life, because we get messages all day long and they can distract us. And it's like, I need to focus to finish and do my job well. Difficulty separating work from personal life, especially if there's drama in the family or drama with a loved one. Making sure to let them know you're at work, and then same vice versa, when you're at work, letting them know your phone's off or that you don't respond to stuff, like some people leave like voicemail messages that they'll call you back tomorrow. Lowered frustration tolerance, like increased countertransference. That's a big word I had to look up in graduate school, but it's what that means is when you see a client and talk with them about stressful events, that stress gets passed on to you. That's what a therapist's countertransference is. Like you absorb their stress. And so you need a self-care device to like get rid of it, just throw it out and reset for the next day. Depression can be a side effect. Assumptive world disturbances, especially with like the war in Afghanistan this week, there's a lot. Coronavirus is another one. Ineffective or self-destructive, self-soothing behaviors. So that could be like drinking, smoking, overeating, gambling, sex addiction, video game addiction, things like that. So any of that in moderation can be fine, but when it becomes like addictions, it can affect your both personal life and work life. Hypervigilance, decreased feelings of work competence, like you start getting stressed and you think you can't do your job because you're not doing self-care. Diminished sense of purpose, loss of hope, helplessness, and or confusion. That can lead to this, which is burnout. Have you guys heard of burnout before? So it is normal, but it also is preventable with like good self-care practice. So compassion fatigue occurs when people living with others experience trauma. Burnout refers to the exhaustion from emotionally demanding work. People who are burned out will experience depleted energy and decreased effectiveness, like it's hard to do your job. Here's some symptoms from it. So people may have the following negative self-concepts and attitudes toward work or school even. You can get burnout at school, like you get senioritis or like the end of the semester blues. You can have boredom, errors and accidents, maybe you like turn in the wrong paper to the wrong class or something like that, like don't cite it properly and then they accuse you of plagiarism. So it's just making sure you like all your perfect P's and Q's are covered. Impatience, irritability, physical depletion. So that's tiredness, pain, headaches, illness. Also feelings of helplessness or hopelessness or withdrawing from relationships, isolation, and then grandiosity. That's another word I had to look up. Do you guys know grandiosity at all? Basically, it's like when you think you're the bomb at everything and like you're so good at it, nobody needs to supervise you or tell you what to do. But the problem is, as social workers, we always have a supervisor and we always have a licensing board to answer to. So it's good to be accountable with stuff. Grandiosity, like sometimes you'll see with narcissism, people that have been diagnosed with narcissism. So the poor self-care deadly dozen. These are a few things that go on. Toxic friends or colleagues. We've all had the toxic friend. We have to get them out of our life until they're well again, or maybe if they never get well, avoiding them. Little fun, like playfulness, humor, laughing, and life or at work. Fuzzy or inarticulated understanding of your own needs. Like, it took me a while to understand I had to eat enough vegetables and hydrate and drink enough water, and like even allergens I have to avoid to not have a like sinus infection. No energy giving personal life. So it should be a reciprocal personal life, like your relationships. You give to them, they give back to you. You give to them, they give back to you. An ability to say no, which as social workers, we all have that. We all get that. The inability to say no. And it's important to say like, hey, I only have 40 hours in the week. I can only do this much. That additional task you gave me, I probably won't be able to get it done until next week. And it's easy to say, yeah, I can do it, or you want to show off and be like, I work this good, but no, I need to do well. I want to do it well, so I want to only take on so much. Also, personal relationships that are predominantly one way, caring relationships with self as giver. As social workers, we are caretakers, so it's important to know that our personal relationships, we don't have to be the social worker there too. We don't have to take care of them. Like we are given time to take care of ourselves. Constant perfectionism in work tasks or, allowing yourself to have a mistake, especially as you're learning, is okay. Continual unresolved, ambiguous professional losses. That could be true of personal losses too. If at work you lost a supervisor or if you've lost a friend, making sure to do the self-care that is required for you to get back up on your feet again. If you have a strong need to be needed, you might want to look at that. There's books on codependency and whatnot. And then professional success is defined solely by clients, students, or patient positive change or appreciation. So like if you always have to have a perfect case with a social work client, like not all cases in social work get resolved, and that's okay. You may have to close the case and you didn't fix them and their addiction recovery or help them perfectly, and it's not your fault. It is okay. Finance, I know the closer we get to graduation and working full time, this is big. In school, it's like how much student loans you take out. So it's important to keep track of all expenses and financial obligations. Mismanagement of finances can quickly lead to unnecessary stress. There are many resources found online and in your library. So just like different books or ways to, they always told me, do you need all of that student loan? I think they give you guys 6 freshman year, 7 sophomore year, 8 junior year, and 9 or 10,000 senior year. And then in grad school, you get 21,000 a year. So it's easy to take too much. But here's like the exercise they say for self-care. One of them, it's called emptying the cup. So you imagine yourself as a cup. You spend your day hearing stories of others, being with them in their pain and joy. You also have your own stories, your own pain, and your own joy. Eventually, your cup becomes full. Some days it's overflowing. You see that you can't hear one more story of pain. You might snap at a loved one. You might feel like sleeping all day as you're just like tired and exhausted. Self-care is what you do to empty that cup. It's critical you do empty your cup every day so that you can re-engage in your life and your work in an effective and healthy way. So here's a few things to do to empty your cup for self-care. So take a long walk, meditate, pray, talk with a friend, listen to music, taking a bath, playing with animals, riding a bike, sit in the sun, eating lunch outside. That's good to like get vitamin D. So like to avoid coronavirus, they say take the 3 vitamins of B, C, and D, and the 3 supplements of elderberry, colloidal silver, and then chaga. That's called chaga mushrooms. Eat in the sun, paint, look at the stars, garden, which you can do here. We have like a good garden space across the street, and then our greenhouse for the winter time. Drink tea, dance, draw, journal, and cook. Read, smell flowers, get a pedicure, jog. I'm trying to see, I meant to send a picture of this to my wife because we're like trying to do more self-care stuff. The running thing, I actually didn't do it all through graduate school. I used to run cross country and I took 8 years off. Then our final paper, your dissertation is 155 pages, so I was stressed out the whole time I wrote that 155 page paper.
How long do you have to do
You get like 3 years.
it? Oh.
So I ran every day. Like I ran a whole marathon in Cincinnati, and then car accident last year made me get knee surgery, so I'm going to try to start running again. Or walk. I don't know if your phone still count your steps. Do like 8 or 10,000 steps a day. I know that's like 4 miles, but something hour of activity. Do yoga. That's what I should do with my knee surgery. Play soccer, lay in the grass, stretch. So that's a good one. Go to church or temple, play a game, laugh, and swim. We're halfway through, and just because it is so hot today, we'll be done at the end of this. So these are 20 years old, but they're still very true to this day. So the emotional self, processing emotions and seeking therapy when necessary. Did you guys know we have access to free counseling on campus? So right across the street, right there. So use it when needed. The financial self, learning good financial management skills, especially if like we start out with low pay and social work. Humorous self, learning to use humor appropriately in the workplace, where serious and often sad or painful issues are being dealt with. Humor has been linked to resilience and coping. The psychologist Viktor Frankl wrote the book about this, Man's Search for Meaning. Also, the loving self, developing and attending to genuine loving relationships that provide support. Empathetic people often have a tendency to give love, like we're always taking care of others, especially in social work, and then forget to focus on getting love. So it has to be a reciprocal relationship where you give and you get back. You give, you receive, and that's so you don't burn out. Nutritious self, so listening to your body, developing good nutritional habits that can sustain and nourish your body. hydration and drinking enough water and eating enough vegetables. Oh, that's like my mantra. Physical self. So maybe have a routine for exercise or vigorous physical exercise. That's like a half an hour a day, and then probably walking an hour a day. And that will reduce stress. Playful self, having free time to play and enjoy life and engage. Priority setting, so managing your time. I always say this in college, like the first few weeks, it's easy to blow it off until like do next week or mañana, we'd always say in Nicaragua. But then like if you do that all 5 classes due next week, you got to pull an all-nighter to get it all done. So if it's like you got a day for each one, tonight, the next class tomorrow, the next class tomorrow, and then you're done. And even time for work. So it doesn't pile up. Recreational self, engaging in a hobby, can provide regular stimulation, relaxation, stress reduction self, and that's combating over arousal, our own reaction to crisis or stressful situations based on traumatic stress responses by developing relaxation, like deep breathing or meditation. They said you can change your blood pressure with meditation, like deep breaths. I don't know if any of you guys use, there's good apps on, I forget the name of it already.
There's one app called Calm.
Yes.
Yeah.
And the Insight Timer, that was the other one I had. And it will do like the bell for mindfulness and let's see if it's still, well, that's wood, but the different to prepare for meditation, like breathe and do other self-care after you exercise. Then the solitary self, I know might be hard if you have roommates. I don't know if you guys all live on campus in the dorms by yourself. So just taking that self-care time, like away from roommates if you have them. And then spiritual religious self, attending to personal beliefs that assist in making meaning of the world and often serve as a grounding force. So some will do this like for meditation, just repeat this. It's a mantra from St. Francis, though. Lord, make me a channel of thy peace, that where there is hatred, I may bring love. Where there is wrong, I may bring spirit of forgiveness. Where there is discord, I might bring harmony. Where there is error, I may bring truth. Where there is doubt, I may bring faith. Where there is despair, I may bring hope. Where there's shadows, I bring light. Where there's sadness, I bring joy. Lord, grant that I may seek rather to comfort than to be comforted, to understand rather than be understood, and to love rather than be loved. For it's self-forgetting that one finds, and forgiving that one is forgiven. It's by dying that one awakens to eternal life. Others use like these meditation apps or books. Here's kind of all the 4 corners. I always say you want to have a balance of all 4 of these. And if you get busy through the semester and you can only do like 3 of the 4, you can still sit on that stool and it won't fall over. But if you're only doing 2, like the stool falls over because there's just 2. You want to at least really want all 4. Physical health, intellectual health, spiritual health, and emotional or social health. If you have to skip on one for a few months for a semester, you probably could make it, but getting back to adding that into your personal self-care plan.
I want to add before you go.
Yep.
Intellectual health. Can you give an example?
Yeah. I feel like they had that one on the very end here too, because I could be wrong. Well, maybe I didn't. I mean, it would certainly be like engaging in a practice that you're interested in, like the major, why you chose social work, you know what I mean? Like you want to be service profession or in the helping professions. And if you were in finance, you probably would not be stimulating that part of your intellectual self, Hopefully, yeah, I thought it was in here, but maybe I skipped it. So yeah, intellectual health, and maybe it's like engaging in conversation. If undergrad is easy for you, go on to graduate school. Or you guys plan on going to graduate school? Do you know? You don't have to, which is nice. Like you can get your bachelor's and a license in social work still. So, and then yeah, this will be I know we already have a genogram due on Tuesday, but like in our next discussion, maybe having us write up a personal self-care plan, or at least thinking about it. So use this information. It can prevent burnout, and it can give you ways to identify stress, and then awareness of your own stress is important to care for others. And that's it. That's all. Got some readings and then the credits, but that's all I have for you guys. And if you have any questions, like, any things you guys do for self-care, chalk all over.
I meditate every now and then. I read a lot.
Okay.
Besides, physical stuff like getting my hair done, stuff like that.
Right. Those are important things, I was asking the previous class, I'm like, what's better, a manicure or a pedicure?
If I can't get my nails done, I have to get my feet
Oh,
done.
so for you it's...
Well, no, I like both. You have to have both done.
Right.
Like, at least have your toes done. If
Really?
You don't have your nails done.
Would other people say differently, you think?
What would you say?
I don't really like nails. I like it.
Really? Is that because it's like a relaxing massage and all that stuff they do at the feet, or?
No, I just don't like nails.
I see what you're saying. Because you could like cut your own fingernails, but feet are a mess, like trying to mess with.
Well, for me, it's just you just need your feet done. Like,
Interesting.
I feel like as a girl, if you don't get your nails done, that's fine with your feet. You have to have your feet painted.
Because I always think you don't see the feet unless if you wear sandals.
Yeah.
So you could just wear shoes on it.
And yeah, it's different for everybody. That's
Right.
How I grew up. Like people always told me to always have my feet done.
Interesting. Yeah, so whatever it is for self-care, and like it mentions this self-destructive behavior, so it could be eating too much, drinking too much, gambling, video games even, stuff like that. So in moderation, any of those can be fine, but they have new diagnosis in the DSM-5 for like video game addictions and, alcoholism obviously, and addiction. If it runs in the family, it's something to watch out for, you know what I mean? Like if you have it in your family. And that's going back to the genogram, which, did you guys have any questions about that at all, or like anything? Does it seem straightforward enough? I'm turning this guy off before it dies because I keep on missing to charge it. That's not. Oh yeah, there is only 3%. Okay. Any other questions? I'm making